Welcome, ladies and gentlemen, to the SAME Environmental Webinar titled COVID-19 Wastewater Surveillance DoD Applications. I'm Tamel Harbison with SAME's national team, and I will be assisting in the background today. Before we get started, I would like to go over a couple of housekeeping rules for today. You entered into the webinar in a listen-only mode, but we also ask that you double check to make sure your mics are muted. For any questions throughout the presentation today, we ask that you submit those in the question tab in your control panel. You will be able to download today's presentation and the PDH certificate for today in the handout section. And this webinar will be recorded to view at a later time. And now, without further ado, I would like to turn it over for our moderator today, Jane Hugh.
Thanks, Tamel. Okay, this presentation is being brought to you by the SAME Environmental Community of Interest. So I did want to bring up our web link and encourage you to check us out at the SAME website and also join our community of interest and attend some of our meetings. Our two speakers today are Aparna Keshaviah. She's a senior statistician with Mathematica, and Mathematica is a policy research organization with a focus on public health and well-being. And our second speaker is Farbod Nekouei. Farbod works for Eurofins QC laboratory. He's the microbiology lab manager, and he's responsible for COVID and wastewater testing that's performed.
All right, this is Aparna, and I think I will kick us off then. So for several years now, Mathematica has been assessing how wastewater testing can boost public health management, first for the opioid epidemic and now for the COVID pandemic. To operationalize a historically academic exercise for policymaking, we really need to look at more than what's in the wastewater. So our research is clarifying ways to synthesize the wastewater data with administrative data and interpret that information for health and safety officials. Today, I'll go through what this innovative tool is, the critical value it can provide for pandemic response, some of the challenges that exist, and findings from our recent wastewater work. Right now, wastewater testing is the only way we can deploy mass COVID testing in a cost-effective and scalable way. Nationally, there's still a shortage of testing, meaning that only a fraction of those who might be infected have been identified. And compounding the problem is the fact that up to 70% of people infected may be asymptomatic at the time of testing. These invisible carriers who may never present for testing could be responsible for the vast majority of documented cases. And then finally, the exponential growth in cases is overwhelming our healthcare systems. So given our inability to fully observe, test, and manage COVID with current practices, we clearly need a better way to assess risk and spread. Wastewater is a relatively new data source that can measure population health in near real time. And I say relatively new because when you look at the history of human tools and inventions, the first sewer system was actually developed 5,000 years ago. The idea to adapt wastewater testing to monitor public health markers came out of the EPA, and in the early 2000s, ONDCP conducted one of the first wastewater pilot studies in the US. That study, which sought to quantify community levels of drug use, confirmed the value of wastewater testing, particularly because it provides information on the amount of a drug being used and not just kind of yes or no whether there was any community use in the recent past, which is the type of information you get from traditional survey data. So across the country, we have 15,000. I have no idea why these things are advancing like crazy. Okay. So across the country, we, so Mal, help.
Let's see what's going on. Let's try this. Okay. Yeah, I don't know why. Do you have it on a timer set base for the slide?
No, not at all.
This is interesting. Let's
Do you have it on auto advance maybe?
I'm not sure I put it on there, but see. Sorry for the technical difficulties, everyone. Let's try to get this situated.
I can also share my screen if that's easier, whatever's quicker.
Yeah, let's I'll make you the presenter and then so we can just rectify this really quickly.
All right. All right, can you all see my screen, the slides?
Yeah.
Great. Okay, so across the country, we have 15,000 wastewater treatment plants that treat wastewater, which is a combination of household sewage, industrial runoff, and in some locations, stormwater. In terms of coverage, these plants capture wastewater from 81% of US households. And importantly, because wastewater from different pipes combines before ultimately ending up at the central treatment plant, the resulting data are not plagued by privacy concerns typical of medical data. When we adapt wastewater testing for public health surveillance, we often move beyond chemical analysis to also perform back calculations that translate to per capita estimates. So for COVID, translating viral loads in the sample to an estimate of disease prevalence is still a work in progress. But from a policy perspective, given that wastewater treatment plants can serve hundreds to many thousands of people, a test of a single wastewater sample collected at the central plant can be a force multiplier, extending the reach of a single test kit and single set of reagents to assess the exposure of not one person, but hundreds, thousands, or even 10,000 people. With different sampling designs, there are different use cases for wastewater testing. So with a single wastewater sample and test, officials can gauge the presence or absence of COVID in their community, which could provide an early warning for new outbreaks. With repeated sampling and testing over time, officials can gauge trends in viral loads to assess whether the number of people infected is increasing or decreasing, and thus when population restrictions need to be adapted based on changing risk profiles. When sampling is deployed broadly in a region, we can pinpoint geographic hotspots or epicenters of the virus, which can provide a data-driven approach to shifting testing, PPE, or contact tracing to where they're needed most. And if we can get to a point where back calculations can yield reliable estimates of COVID prevalence, we could better characterize disease transmission risks and evaluate the effectiveness of policies and programs to curb spread. So each of these 4 use cases for wastewater data has different challenges and unknowns. Snapshots can give us reliable information on whether the virus is present, but to confidently declare that the virus is absent and no longer circulating in the community, we need robust data on how the limit of detection or limit of quantification is influenced by the specific assay used, by environmental conditions like temperature and rainfall, and by sample type, for example, whether it's a wastewater sample or a sludge. Next, when looking at trends in viral RNA concentrations over time, it's unclear what the best metric is for reporting. So for example, whether concentration should be standardized by wastewater flow rate on that day or by per capita contributions to the sewer. And different metrics can lead to differently shaped trends. Third, when using hotspot analyses, we're essentially comparing one region to another. And so here sampling considerations come into play. We need to make sure that a sample is representative of the wastewater treatment plant service population, especially if we're collecting point-in-time grab samples rather than 24-hour composites. So for example, if we collect a grab sample in the morning rather than the evening to capture that big flush, we might be missing shift workers whose schedules vary from the norm. Also, if decisions made with wastewater data will affect a larger community, then we need to look at the demographics of the service population versus the community at large to see if they're aligned with respect to risk factors like old age or pre-existing conditions. And then finally, to be able to convert wastewater viral concentrations into reliable estimates of COVID prevalence, we need to better characterize the timing, duration, and prevalence of viral shedding in the stool. Despite some of these challenges and the ongoing needs for method optimization, we can give policymakers confidence to act on wastewater data if we see strong alignment between wastewater data and public health data that officials are already monitoring. So for example, Petcha et al. At Yale reported that smooth trends in wastewater RNA levels over the span of 6 weeks mirrored trends in confirmed cases. And furthermore, they showed that wastewater data was a leading indicator, providing insights into changing infection rates 1 week ahead of time. Taking that notion one step further, at Mathematica, we've been contextualizing the wastewater data with a much broader set of community data to gauge local pandemic vulnerability and healthcare capacity, for example. We applied this data triangulation approach in a recent pilot study we completed to help validate wastewater testing for SARS-CoV-2 in rural populations. We focused on a mountain community in Western North Carolina. Our study yielded 3 key successes. So we were able to show, 1, that viral levels were quantifiable despite fairly low infection rates in the community. 2, that trends in wastewater data aligned with trends in confirmed cases and a proxy measure based on COVID-like symptoms and doctor visits, as seen in these graphs. So you can see there was kind of a steady decline over the 4-week study period. And then 3rd, we found that wastewater testing provided a lead time of 8 to 10 days for changing infection rates versus individual testing data. So this navy line, you can see there, the decrease occurs about 8 to 10 days before the decrease in the lighter blue line. But the study also confirmed areas where improvements are needed, and that includes handling measurement inconsistencies from one day to the next, Monday versus Tuesday samples, and getting lab results to officials more quickly so they can actually act on this information. To facilitate timely reporting and interpretation, Mathematica built the dynamic data dashboard tool shown here. So the dashboard compares trends in wastewater loads of the virus with trends in confirmed cases or proxy measures. It geographically contextualizes the wastewater treatment plant service area within the county and then the state. It also provides information on community features like provider capacity, test positivity rates, and population mobility. And then finally, it reports the prevalence of underlying conditions associated with severe COVID presentation, as well as a measure of pandemic vulnerability. A key strength of wastewater data is the ability to measure several public health biomarkers and give officials information about a wide range of public health threats. Everything from pathogenic bacteria and viruses to health and wellness markers to drug metabolites. Once workflows are set up for COVID monitoring, that same infrastructure can provide officials with an early warning for new unseen health threats. Historically, there have been great success stories for the use of wastewater testing to address disease epidemics. So about a decade ago in India, there was high transmission of the wild-type polio virus, and eradication efforts were plagued by low vaccine coverage and poor monitoring. But ongoing sewage testing alerted officials to reemergence of that polio virus. A few years later, Israel experienced a silent polio epidemic, and fortunately they had a robust sewage surveillance program in place, which led to early detection and enabled mobilization of vaccines before any cases of paralysis emerged. And then in the US, we've been using wastewater testing to help officials combat the ongoing opioid epidemic. So combining wastewater data with community public health and public safety data allowed us to assess black market activity, policing impact, and shifts in drug use. I'll end by illustrating that last point based on results from a recent analysis we completed in collaboration with Montana State University. We compared wastewater data with local data provided by emergency medical services, law enforcement, and a pharmacy to assess how wastewater testing in 2 communities, one urban and one rural, could be used by local officials to address their opioid epidemic. So we obtained EMS logs of drug overdose calls. Superimposing the timing of these calls onto the wastewater-based trend lines of community drug use, we found that wastewater data might be able to predict when EMS would be called into action. So calls for overdoses involving a particular drug surface soon after high levels of use of that drug in the community. And this pattern held up for many drugs that we assessed, and even when wastewater samples had drug concentrations below the limit of detection, as was the case with heroin. Wastewater testing also allowed us to measure how major drug seizures by law enforcement impacted community drug use. So after each large seizure of methamphetamines or amphetamines, which we show in red here, over time, estimates of meth use, amphetamine use, or both decreased. The key to these insights was data triangulation. So operationally, implementing wastewater testing requires coordination and communication between at least 3 key entities: city and state officials, wastewater utilities, and testing labs. But for the resulting data to inform public health management strategies, another set of activities is required. Once the lab report is ready, the information needs to be examined in the context of existing local data and then combined into a unified data stream. Creating that data stream requires a few steps, including aligning the local data to the population served by the wastewater treatment plant, using data triangulation and analytics to fill gaps and uncover hidden insights, and synthesizing the information to inform policy management decisions. From our perspective, working with both academic researchers who are validating the methodology and with public health officials who need the results, this type of data synthesis and interpretation is key to the success of this innovative methodology for public health measurement. Thank you.
Thank you, and good afternoon. My name is Farbod, and I'll be presenting information on the Eurofins QC molecular testing for SARS-CoV-2 in wastewater. Routine wastewater surveillance could be used as a non-invasive early warning tool to alert communities to new COVID-19 infections. The test is done on a 250 ml subsample taken from a flow and time-dependent composite sampler, and is completed by a real-time PCR molecular approach that targets 2 genes from novel coronavirus. The test can detect a virus at 0.1% of the population that can report a value within 48-hour turnaround time. So by using a molecular technique called real-time PCR, we can correlate the presence of the viral RNA with the COVID-19 cases in each community on the day of sampling. This method, which is known as wastewater-based epidemiology, could provide an effective and rapid way to predict the potential spread of novel coronavirus by picking up biomarkers in fecal matter from disease carriers that enter the wastewater system. It's been shown that novel SARS coronavirus has been detected in fecal matter of both symptomatic and asymptomatic people. So knowing this information, we can provide a real-time outbreak data at a site of sampling, which could be an important approach for monitoring the spread of the virus. Let's discuss sampling consideration briefly. We recommend that sampling locations are representative of the population that you want information about, making sure that you can identify what locations feed into the sampling point. For example, a wastewater line cleanout port outside a university dormitory would be a location where one could take a representative sample of that population. Other locations to consider sampling from would be a manhole that are before the city sewer line, or influent points to a wastewater treatment plant. In terms of determining sampling frequency, we would encourage conversations to be held regarding both the goals for conducting the surveillance and your risk profile. Factors that might influence a decision on sampling frequency could be information such as what kind of viral activity is being seen in a local community and what risk factors from the population standpoint exist, including immune status, age, etc. And lastly, what does the budget allow? While we can provide some general guidance regarding this consideration, they may be best answered by a consultant who can design a sampling program specific to your needs and risk profile. Eurofins can help support initiatives to establish a relationship with consultants nationwide. So let's discuss briefly what Eurofins will provide to our clients. First, the analysis on the report, which I'll discuss in more detail on the next slide, but the report will indicate two things. The absence or presence of SARS-CoV-2 within the sample that was analyzed, along with a CT value. That is a value that can be used to indicate the strength of the viral load and can be trended over time. Again, I'll share more information on both these slides in a few minutes. We'll also be sending you all the items needed to return the sample back to our laboratory in Horsham, Pennsylvania. Including the kit are items such as a 250 ml sample container, sample labels, chain of custody, insulated bags or coolers, and a FedEx return label. We're strongly recommending to use a composite auto-sampler to collect the sample. Eurofins is more than happy to assist in finding a sampling equipment or can even arrange a turnkey sampling solution if you need it. So there are two key elements to the collection of a sample: the way the sample is taken and the way the sample is stored. The sample must be removed from the stream in such a way that the integrity of the liquid sample is maintained. Untreated wastewater samples should be collected from the waste stream or collection point at a flow proportional or time-dependent frequency using a composite auto-sampler within 24 hours. As mentioned, Eurofins will provide a sampling kit to assist in the sampling process. We recommend collecting a minimal 1 liter composite sample utilizing an automated sampler such as ISCO, preferably over 24 hours time period. We're asking for 1 liter sample to be collected, from which a 250 ml subsample is poured off and sent to the lab. It is important to note that the duration of the sampling period is truly dependent upon site and population consideration. For example, taking into consideration time during the day in which a location may be vacant. As far as the method development, Eurofins have developed primers and probes for SARS coronavirus detection in wastewater. Eurofins performed over 700 tests on unique samples from unique sites to create the testing protocol. The test protocol was developed based on multiple published international studies on the detection of viral RNA in wastewater. So our current wastewater process is divided into two macro steps. The initial step is the pre-treatment protocol that follows the extraction process, and then a real-time PCR assay that will analyze the extract. Our current analysis performed are using Eurofins Technologies' VERSIC real-time PCR platform that targets selected genes on SARS-CoV-2 genome, which is in accordance with the World Health Organization WHO recommendations. So before the PCR analysis, the sample must go through pre-treatment step for the extraction. In our protocol, the sample is centrifuged to separate the suspended solid from the liquid. This step helps to remove larger particles such as debris and bacteria from the liquid phase. Another centrifugation step is added, which will separate the virus from the supernatant and create a pellet, including a fragment of the RNA. Then the viral RNA is extracted from the pellet and analyzed by the real-time PCR. So I'll talk briefly about real-time PCR and how it actually works. Nucleic acid amplification tests, such as PCR, is one of the common detection methods for DNA and RNA by the molecular approach. Viruses can have either RNA or DNA, and this particular virus has RNA as a genetic material, where we can use a real-time PCR platform to amplify and detect it. So the extracted RNA from the previous step undergoes a reverse transcription step to form a complementary DNA or cDNA. Then we use enzymes to amplify and create duplicate copies at each cycle. As you can see on the left, the replication goes from 1 strand to 2, 4, 8, and so on, and each cycle until it eventually produces a signal that's strong enough to be captured. Then the cycle number at which this happens is called the cycle threshold, or CT, that you'll see on the report. As an example here, we have an amplification plot where the PCR cycle number is shown on the x-axis and the intensity from the reaction is shown on the y-axis, with the CT value on the amplification curve. So the higher the initial number of RNA molecules in the sample, the faster intensity will increase during the PCR cycles. In other words, if a sample contains more RNA, then it will be detected in earlier cycles, which would lead to a lower CT value. On this slide, we have an example of our current PCR report for the detection of the coronavirus in wastewater. The first page on the left includes the client and project information, and the PCR results are shown on the second page of the report. The sample result page shows the information that would indicate if coronavirus was detected in the sample, and if detected, the CT value will be shown under the results section. For example, here our detected CT value is 34.67. The raw data is typically analyzed by using the software that's provided with the thermocycler, and final results for interpretation is a semi-quantitative data, including a target-specific CT value. Again, the CT value tells us how many cycles it took to detect the signal from the sample, meaning the higher the CT value, the more cycles it took, and the lower the RNA content. And finally, the CT score offers a full tool for providing real-time trend data to understand the impact over time. The CT value collected over a period of time can be easily done as an early warning sign of a spike in the community. For additional information and questions, please feel free to email us at covidww@eurofinsus.com.
Thank you, Aparna and Farbod. Now we would open it up for questions. If you want to send questions in the chat box, it would be great. I did have a question for Aparna. Aparna, wanted to see how you've seen this in the real world used for operational decision making, especially where the population, I think where where I see it or where I asked questions about it is how it can be used, especially when the population is asymptomatic, to catch COVID in an early stage and maybe minimize transmission.
Yeah, so right now, at least 42 out of 50 states are implementing some form of wastewater surveillance. So it has seriously skyrocketed since, and thanks to the COVID pandemic. One of the best success stories comes out of University of Arizona about a month or month and a half ago. So University of Arizona returned to on-campus classes in the fall, and they were actually doing individual testing of all students, but that's not practical to do on a regular basis. And so although they had tested all the students before they entered the dorms, they then shifted to wastewater testing. And what they were able to find is one morning, they went from 0 viral particles, RNA particles in the wastewater, to finding some. And those samples that they collected, so essentially they did grab sampling in the morning right outside of a dorm. They tested those samples on campus that afternoon. They projected, based on preliminary models, that the viral loads meant between 2 and 5 students might be infected. And they held an emergency meeting that night. They decided, given this is still a budding methodology, let's repeat the testing the next morning. They did repeat that testing. They found a consistent set of results. And they essentially went into the dorm and they did rapid swab testing with all 300 students then, again. And they found 2 asymptomatic students out of the bunch. So they isolated those students, moved them to a different dorm, repeated the wastewater sampling, and found that the viral particles disappeared. So it's a phenomenal example of really the power of this methodology to find low levels of infection that are lurking completely invisibly because people just aren't showing symptoms most of the time.
Okay, great. And then the first question I got was if this webinar was being recorded. I do know that this was a busy day for a lot of people, and the question was the person has staff interested in the topic but not able to attend. And Kamal, I do believe we're recording this, correct? So we would be able to share that.
Correct, yes. They will be able to view it at the Environmental COI webpage at sme.org later this week.
Okay, thank you. All right. And then have there been any applications to military installations, and how could this be applied? I'm not sure that Aparna would know that. Aparna, do you have any? I have heard from DoD contacts where they're interested in application, but I don't know if it's, if you're aware of where it's being done at all.
I'm not aware of specific DoD uses right now. I can tell you historically that there have been Like prisons have been certain populations that have been isolated. I think right now, a lot of that upstream sampling is being used to target universities and long-term care facilities. But you know, things are changing week to week. So I imagine there could be some on-base sampling being done, but I'm not aware of it personally.
Okay. And then Farbod or Anne or Brandon, are you aware of any that, you know, maybe where it's visible to us that installations are doing it? Otherwise, I can share what applications people have told me about.
Hey, this is Brandon with Eurofins QC. So currently we're not working with any DoD clients and related to the wastewater sampling. You know, a lot of what Aparna said and related to universities, long-term care facilities, prisons. However, I think you know, in terms of DoD applications, you know, at least in my mind, things that come to at least come to top of mind in terms of where this could be potentially a useful application is thinking about you know, either on-base housing for you know, junior enlisted soldiers, potentially for barracks and initial entry training, either at you know, basic combat training, AIT, things like that, where you have a population that doesn't change drastically from day to day, so they're pretty much sleeping there, you know, for an extended period of time. Again, a great opportunity to conduct surveillance of that population. Without you know, having to do the invasive or the more costly approach of individual swab testing.
Right, exactly, and that's exactly what I had heard about too. And on the flip side, for training, what I had heard is, you know, if they're monitoring continually, then when you know, new people come into training, well, again, it's just a place to test and see, do you have an issue going on? Do you have some asymptomatic people that have come into the population? Another thing that was discussed was, you know, the civil employees that work for the government, you know, or there's off-base staff that, you know, are coming on and off. So monitoring it through the day tells you, you know, are we, you know, in a good place there? Depending on where the staff are located. So yeah, that's kind of what I have heard too. You know, and a lot of these are almost like towns. So I think you know, that's important. And I thought the slide about Aparna's taking our test results and laying that over actual emergency you know, runs and things for opioids or for, you know, for drug issues. I think the same goes to play, you know, what I continue to hear is people are worried about, you know, hospital availability and medical use availability. And I think that's another thing, is just anticipating that, hey, we're going to have a surge here, you know, would be a positive for that. So, okay. And then let me go to the next one. Get DoD. How do you see it used in DoD? Oh, one question came up about naval vessels. And I don't know if you know, any of our speakers have something to add to that. I do know that it was looked at for cruise ships, and I would assume that it's the same, you know, for naval vessels. But any thoughts on that?
I don't know directly how the sanitary systems are set up on those vessels, but there is research looking at, I briefly mentioned kind of wastewater versus sludge samples. And because the virus is shed in stools, you can actually detect it more readily if you're not waiting for it to leach out of the stool into the water, but you're actually taking samples of the stool, essentially like a mass stool test. So there is some developmental work being done, whether that is in porta potties or other types of non-standard sanitary systems, that there is work being done to develop methods, and they show, you know, just as much strength, I think, as the standard through the sewer system as well. So I don't think there's a reason to believe it wouldn't generalize.
Mm-hmm. And I think we also talked about people are putting in, you know, mandates and stipulations to try to control spread, and it's a way to say, are we being effective? You know, but again, not an invasive way to check a population. Is what, you know, is what we're putting in place actually working? Okay, then we have a question about what type of infrastructure is, okay, let me see here. This is all operator error. What type of infrastructure improvements are required to support monitoring? And I don't know if that was answered with the, you know, with the question on the sampling, but is there anything you can add there?
I would say it builds on existing infrastructure. I mean, every day, wastewater operators are collecting samples of influent and effluent because there's a panel of about 90 EPA mandated contaminants that they have to test for. So we're talking very minimal extra time to either collect a larger sample or just collect an extra sample and ship it off to a lab. The different labs have different processing. So, you know, some labs you can just ship on ice. Other labs say you have to pasteurize it with a heat bath. You know, there are, because the demand for this tool ramped up so quickly, supply is still kind of catching up, and there aren't a lot of labs that aren't at capacity already. And the methodologies do kind of vary. So there's, you know, PCR, there's real-time PCR, digital PCR. There are kind of different methods, and CDC is working to standardize and look at kind of best practices and how things vary. But in terms of actual sampling, you know, unless you are the 19% of households that are on a septic system, pretty much existing sampling procedures will capture your wastewater.
And I think that was some of the beauty of it, is we already have people who are doing that wastewater sampling. So it's just, you know.
That's right. And a lot of them are doing this in kind. You know, they're not saying that this, right, it costs extra money for us to collect the sample because it's such a minimal additional effort.
Right. Right, exactly. And then Farbod or Ann or Brandon, do we have any input on the samples? I know we're doing a quick turn on everything that's received. Is there anything to add on the sampling side of it or shipping?
I think from a sampling standpoint, you know, really the only, I wouldn't even call it a limiting factor. It's much of what's already being done. Again, to Aparna's point, you know, these samples are being collected. What we're asking to receive samples is just that clients use an automatic composite sampler, which again gives us the opportunity to kind of take a look over a 24-hour period as an example of the flow that's coming out of either a manhole directly from a facility, again, to give us the most representative view of that population. So that's really kind of the only, I would say, limiting factor. You know, grab samples in this application would only provide you a true snapshot in time. So whatever happened to be in that, you know, manhole or that outflow at that specific instance. So, you know, again, we're asking for a 24-hour composited sample, you know, asking that clients chill those samples and send them to us, and then we are providing results within 2 business days of receipt of those samples in the lab. So again, it's a timely turn, understanding that this is an opportunity to allow decision makers to kind of evaluate what the data says, and the intent again is that we're able to conduct you know, surveillance of a population and potentially identify, much like the University of Arizona kind of case study, asymptomatic people within a population, you know, and then this fits into the rest of whatever the client's risk mitigation strategy might be related to COVID. So maybe that next step is, you know, isolation of individuals, it's doing clinical testing. So again, this is not a solution, but rather a complementary option that really fits into the rest of kind of what those risk mitigation plans look like.
Right. Okay.
And I'll just add that you know, different communities have different needs in terms of sampling. Like I think generally the consensus is that whether it's a time-weighted or flow-weighted 24-hour composite, that's a way to get a more representative sample. But University of Arizona, for example, did every 5 minutes, they did a grab sample over a span of 25 minutes. And when we're talking about a university dorm where people are kind of there in the morning and evening, and then they go off to other buildings for classes, maybe grab samples are okay. And so those are the types of, decisions that we kind of help inform is looking at other data, looking at risk profiles with epi modeling, understanding, the setup and the movements in your community. All of that feeds into the sampling plans and types that you might choose.
Right. Okay, and our next question, are there safety concerns with sampling the wastewater? What kind of PPE and other protections do you recommend at the sampling phase? I know, Anne, you can add to that. Aparna, do you, I don't know if you have anything, otherwise we'll let Anne.
Yeah, I'll just say that CDC has, they had initiated a study to look at infectivity of influent. Once the wastewater is treated, we have confidence that there are no longer infectious particles. But here we're talking about getting the influent wastewater before it's treated. Even then, there is very little evidence that there's any risk. And as far as I know, the standard PPE that wastewater operators are already using, the boot coverings and coveralls, all of that is adequate, is the current understanding as far as I'm aware.
Okay. And Anne, do you have anything to add to that?
I'll jump in on that one. So really from a PPE sampling standpoint, prior to being treated, we're really following EPA guidelines, which would be no different than what would be kind of the procedures when sampling wastewater in general, right? So think things like wearing a Tyvek suit, gloves, face shield, mask, goggles, but nothing in particular specific to sampling, just because we're analyzing it for the SARS-CoV-2 virus. So again, just very, consistent with what EPA guidelines recommend in doing any kind of wastewater sampling.
Okay. And then we did have a question on how samples should be stored prior to and during shipment. I think we talked about them being iced during shipment. Someone has to take a sample and can't get it in the mail, same day. Is there any particular things that they need to do to store the sample?
We certainly ask to keep the sample chilled at 4 to 6 degrees C. The temperature basically is very important for the RNA basically stay consistent during the sample. So they cannot submit it overnight from the day that it's been collected. They can save it basically until next day, but they prefer to be here within 24 hours of collection because we want to basically have the RNA contained in that sample.
Okay, and they also asked about if the sample needed to be pH balanced. I don't think we do anything with it other than chilling, correct?
Correct, that's not required for the wastewater for SARS-CoV-2.
Okay. Okay, and I think that is it for our questions. I don't know if anybody else has questions. That is it. Okay. And so we'll give it a minute and see if anybody else has questions, and otherwise, I think we did have an earlier question from somebody who wasn't able to attend about sensitivity of the test. Farbod, I know you said we are reporting things on a 48-hour turn, and we have done things quicker than that. But is there anything else on the sensitivity you want to talk about?
Sure. So based on the data from our method development, the estimated sensitivity of the method is approximately 0.02 up to 0.1% in the community that contain infected individuals. So that's about 2 positives per person. 2 positive person in a 10,000 community, or up to 1 person in 1,000. So that's basically our method to develop that part.
Okay. And I know in Aparna's, example, that was a 300 plus person dorm with, their workers in it. The people. So I know it's a good, highly sensitive. So, one application too, since we're talking about DoD applications, I know one was just, with campuses. And so I think whether it's installations or if there's schools, that, there's applications there just because you have a large concentration of people. Okay, I think that is it, unless, oh wait, there's another one. Second. Trying to. Oh boy. Okay, here, just a second. Got a couple more. Did soap or other detergents in the wastewater damage the sample RNA? Inability to test the viral load.
I can answer that. So it depends on how much is added. Typically, we'll actually find that out earlier than before we get to the data, because basically what we're using spike recovery. So if our control basically fails, we know there's something in the water and it's basically interacting with the SARS-CoV-2. So unfortunately, there's not really enough research to figure out how much it will interfere or not. But again, based on the data control, when it comes out from the laboratory, we can confirm if the data is invalid. We have to recollect another sample or not.
Okay. And then another question we got was, are we aware of government grants to help fund the sample testing? And I know Aparna, you and I talked about that a little bit. I'm not sure if you want to add anything there.
Yeah, it is a bit of a mix. So CDC is doing some work on building a national wastewater surveillance system. So they are providing, kind of piecemeal funding to states, who then kind of trickle that down to surveil particular communities. There have been specific states that have also put forth money for this, but sometimes it's through like a request for proposals that's open. Sometimes it is through other channels that aren't competitive. So I think there's a lot that's being done behind the scenes to get this up and running. And it is kind of a mix and match approach right now from one state to the next.
And then the next question I got is wastewater sampling effective for COVID-19 when it's so pervasive?
I'm not sure what the concern is there. I think the larger concern is when it's not pervasive, can you detect it? Are your methods sensitive enough? When it is so pervasive, you will see, so viral shedding, best we know right now, might occur a few days before symptoms appear, if they appear at all, and last for something like 30 to 40 days after infection begins in somebody. So once people clear the infection, you will start to see the viral level decrease based on in their stool. So, over time, you will start to see rises and falls in viral RNA levels as the infection spreads and moves. One of the studies we're trying to launch is looking at the impact of tourism on population risk. Tourists often won't, even if they feel sick when they're on vacation, say they may not present to be tested until they're back home, but everybody has to use the bathroom, and so they will be contributing to the wastewater, and we can measure, kind of the impact that they might have. So even though it's pervasive, what you see is, in a particular community, you'll have viral levels that wax and wane over time. And when you superimpose community actions, policies, programs, things that are changing in terms of business openings, closings, population migration, you can then start to tell a picture of why things are waxing or waning and begin to evaluate the effectiveness of different programs and policies.
And also see, is that a normal cycle, or is something, going up or down, like you've got
Right.
staff coming in and off, right? Okay, then another question we have is this technique better suited for outbreaks versus pandemics?
I think it's most powerful to detect an outbreak before it becomes a pandemic. So to find that next threat, whether that's a virus or bacteria or, a drug epidemic, I think it is the best use of this is really to say, hey, you have something new in your community that you aren't aware of. You better pay attention to this. But I think right now we're finding that it is very instrumental. Like I said, it's the only way to mass test a population for COVID, and it provides insights that individual testing just isn't getting at. Weekly, we might be testing 1 or 2% of the population, not 40 to 80% of the population that's on a sewer.
And I think the benefit too is the, like you're saying, is the confidentiality of it, and yet community health and community response or level of infection. We talked about this with drugs or with PFAS or with, and then also with, with COVID. But I think the thing with COVID is, people are afraid to go get tested. People are, maybe asymptomatic and not realizing, they're not all savvy on environmental and epidemiology and medical things. And I think it's just kind of a good way to not be invasive, but still track what's happening in a population. Maybe you do some initial checks and find out where your, like you said, hot spots are where, are ones that you would want to monitor.
Yeah, and I would actually argue that this type of tool, which is a population level, is maybe better suited for things like pandemic, which affect everybody, because you're not taking a microscope to look at something. You're really getting a global view of what's happening with an entire community. And that's what you want when you have something that's this widespread.
Or I know I keep coming back to this through our discussions, but it's just, different communities are putting in different safety measures to try to control it within their population and their control over, their community. And I think just knowing that the actions taken are bringing down the viral load is going to make everybody maybe, get in line. So, to me, that was a benefit too. Again, I don't have to go outside my door. I don't have to give a blood sample. And also that kind of not, it's the whole community, it's not individuals, and there's there's no public, you don't need to go out to get a sample taken, and also there's nothing that's, Jane Huber has this, or Aparna has this, or Farbod has, this kind of a way to drill down and protect the community, but also know that those measures you're taking are being effective. Okay, I'm going to see if we have anything else here. And I would encourage, if there's, if there's people that are on the wastewater side, like, I think the other thing is just you're already out there taking a sample. It's, it's just a way to, maybe not have to have that extra cost, but, have another data point. So, yeah, I'm trying to see if I don't think we have any more questions. I'll give it a minute here. Otherwise, we're kind of close on our end of our time anyway, but great questions. Yeah, so I'd encourage you to share it with other people that are in the wastewater practice for your group, or if you work with, campuses of any sort, whether it's a college or a business campus, or a commercial industry that has a campus, it would be great to get the word out. And like Jamel said, it will be available on the environmental COI web link that we provided. And I think that is it. I'm not seeing any other questions. All right.
Well, I just want to thank Aparna and Farbod for an amazing presentation. It was very informative. Thank you, Jane, for an excellent moderating job. For an upcoming event, we do have our 2020 Virtual Small Business Conference held in 2 weeks from tomorrow, November 4th to the 6th. You can find out more information at smesbc.org. Get registered. I think we have a great conference planned ahead. A lot of new features that you probably haven't experienced yet. So go ahead and just go check that out and get registered. Again, the presentation PDF version is available in the handout section as well as the PDA certificate. So go ahead and download those 2 documents now in your control panel and enjoy the rest of your day. We're looking forward to see you at SBC.
Thank you.
Thank you.